introduce myself. My name is Lynch, and I work at the National Adult Literacy Agency in Ireland. And I suppose what I hope to do today is just talk about, describe the story of health literacy, and talk about what has happened up to now, future developments, what needs to happen, and new opportunities in Ireland. Just to explain, Ireland has a population of 4.5 million. We're in the middle of a baby boom right now. We have the highest birth rate in the EU. We also have an ageing population. And we actually have a diverse population, which is really a recent event. We have 12% of immigrants, people have come to Ireland from Poland, Lithuania, Sri Lanka, the Philippines, to work or study. And that has implications also for health policies. And I think some people working with the public have also found that very challenging. So, NALA stands for National Adult Literacy Agency, and it was established 30 years ago. It's unique in that it's a non-profit volunteer organisation. We get a core grant from the Department of Education, but we are independent. And that means that we're free to engage in lobbying work, which is really important. Now, the agency also relies on extra funding from different agencies as well to develop projects. And I suppose in recent years that money has been cut consistently with the recession. So for example, we have projects in workplace literacy. We also have projects in family literacy programs, and some of them are under threat just with the recession. And we have that budget coming up in December, and we have been warned that it's going to be a very harsh budget. 70% of the education budget in Ireland and the health budget goes on staff, and we have national pay agreements. So really, the ministers have explained to us that they can only play around 30% of the budget. So we have been warned that there might be another cut on the way. So just to expand, I'm just going to give you this image here, which was designed by a colleague of mine, and it just explains the kind of work that NAL is engaged in. And I suppose since the results of the International Literacy Survey, NALA has tried to make adult literacy relevant for people working in areas outside the education issue, because of course it's a civic issue. And I think that's a very good image of the kind of work that we're engaged in. Our definition of adult literacy as well is quite broad. For example, we talk about literacy involves listening and speaking, numeracy and using everyday technology. But we also talk about the fact that it includes more than the technical skills of communication. It has personal, social and economic dimensions. Adult literacy learners are represented on our national committee, and they're actually represented in all our committees and in all our projects as well. So, it keeps us grounded. So I just go back there. And just to explain, in Ireland, we have 55,000 Irish adults attending their local VEC, and the local VEC would be the main group body responsible for providing adult literacy tuition. It's a new profession in Ireland, adult literacy tutors. It's a professional profession, but there is also a reliance on volunteers for one-to-one tutor. So if you're a member of the public, and if you want to improve your literacy skills, you contact your local VEC, you will be assessed, and then you usually start off on a one-to-one basis with a tutor. And when appropriate, then you will be encouraged to move into a small group. And also in Ireland, we can now offer accreditation for people with relatively weak literacy skills. So that's a very big development. Now, I know that the actual results here look quite old, because I'm referring to 1997, and we will have refreshed adult literacy results next year with the PIAC. But for the minute, like the government, we still post 1997 adult literacy survey results. I'm sure people in this room were familiar with adult literacy, were very familiar with this survey. It was based on a 5-level sliding scale, with level 5 representing very good functional literacy skills, and level 3 was considered the norm to cope in societies. And 25% of the Irish population scored at level 1, which meant that they were struggling with everyday materials. And one of the everyday materials that they used in this survey was actually a packet of aspirin, where they asked people questions such as, how long can you take tablets? How many days can you take these tablets? And 23% of the Irish population could not answer that correctly. So that was actually very relevant for now, because we had been used to getting phone calls from people in the health service telling us that they weren't too sure their clients were understanding instructions, and here we actually have the proof. So that was a very powerful example. And those results came out in 1997, but this really is the most important publication in Ireland when it comes to health literacy, because it was the first health paper that acknowledged health literacy and talked about literacy being a barrier to health promotion. So the agency contacted the Department of Health, and we sat down and we actually came up with a strategy. And I suppose just to go back there a second, with this strategy, this is the actual definition that we've always worked with. Adult literacy learners really like this definition, as do literacy tutors. It's very balanced. I think it's very straightforward. And I know other definitions have been produced in the meantime, but it's still the most popular one among our clients. So we go back to our strategy, which was produced in 2002 and launched by Rima Roach, who travelled to Ireland. And we were very grateful to have Rima there discussing our strategy, and it was very, very exciting. And to be fair, the health promotion unit really have been the driving force when it comes to health literacy in Ireland. I suppose it makes sense in a way, because health promotion practitioners work on the ground, so to speak. They work in education, so it's a good match that they would liaise with adult literacy practitioners. I have here the role of plain English, because it actually, plain English, we find, has actually been a very important ingredient. The agency has very much developed its skills when it comes to plain English, and I think is seen as a very credible agency when it comes to editing materials and making them literacy friendly. And we've actually trained 300 communication staff. That would be people largely working in the health sector and for the government. And plain English service is used very much for national strategies. I'm thinking of one which is the breast check, which is a national breast screening program. And I always cite it because it's a very good example of an initiative who embraces health literacy and literacy from the onset. And they have done great work. Their staff are literacy friendly, their material has been literacy approved, and they use focus groups continually to improve their service. So plain English has been a very powerful tool for the agency. Another thing, we produce teaching materials, all very necessary, produced by health promotion people and literacy staff. Used on the ground, and very important when you're trying to integrate health into a literacy program. And then, inspired again by Rima Roach's work with Jenny Anderson, we produced a health literacy tool. And I think this document has been very important for now when we're trying to get into clinical settings, because we have we've been embraced by the health promotion profession, but it's a bit hard when you're trying to get into other areas. And this publication, what it does for us really is it translates health literacy into practicalities, because it asks people to analyse their own setting and their own procedures. So we use that in different clinical settings when we're invited. In 2007, we were approached by Workshop and Dome, who were interested in developing health literacy in Ireland, and that's proved to be a very interesting collaboration. For example, we have developed a health literacy website, which is super. And more importantly, every year we have what's called a Crystal Clear Awards, and that's where health practitioners on the ground in different categories tell us about the kind of work they're doing and how they're making efforts to make the material and their practices literacy friendly. And that's really super for the agency, because it means that we have access to a wide variety of health practitioners. And I think it's good as well to reward people doing their best on the ground, trying to make a difference. Okay, so that's just basically a summary of what our health strategy has been. We've all had a bit more energy in the last 2 years, thanks to work. Christine Sorensen will be talking about later on the European Health Literacy Survey. When Rima Rose was last over in Ireland in 2009, we introduced her to our Minister for Health, which was very Harley, and we got money from the National Lottery so that Ireland could take part in the European Health Literacy Survey. And there are the results. Basically 40% the Irish public have weak literacy skills. And we didn't do too well either at the very end. 21% respondents had excellent. So the good thing about that project is that Merck Sharp and Dome actually gave money to NALA to organise a number of roadshows where we actually publicised the findings and also engaged in plain English training. Okay, so just in terms of what needs to happen, we are very grateful to the American research and Canadian research, but we do need Irish research just to come up with Irish solutions. We need health literacy integrated into all national health campaigns automatically. That is happening at the minute, but it needs to continue. I also have here that we need to integrate health literacy into training at undergrad level. I think that will happen when we have more Irish research. I just want to show you one statistic here. This is based on, again, Merck Sharp and Dome sponsored questionnaire among medical doctors in the community. And the results were fairly depressing, I think, really, because I do hear from practitioners that, yeah, we've done communication research, yeah, we've done communication training at undergrad, and yet the finding that the one in the middle here was particularly perplexing. Nearly 40% had not received training associated with patient communication skills. So that just shows that the road. The other thing is, in Ireland, health literacy isn't part of our Irish healthcare accreditation, and ideally we'd love to see that happen. Again, rewarding good practice, a national awareness campaign among the public. I think there's a role as well for the public to start demanding a better communication. So I was thinking of, in Ireland, I was thinking of Don Lookbeam's paper on developing health policy recently when I was writing this, because timing is everything. And our health promotion strategy has finished at this stage, so really we're looking for a new one. And I think that might come. The public health strategy, the third one down there, will be launched in the next few months, and we are really hoping that health literacy will be mentioned there, because that really is a refreshed health promotion policy. The cardiovascular strategy, which was published last year, did actually cite health literacy, which is interesting. So again, now we're campaigning for action to come from there. And I have professional competency there because only last year general practitioners in the community engaged in a professional competency programme.